So let's talk about a JAMSS protocol. We're going to start with what is JAMSS. It stands for jaw, joint, and muscle sprain and strain. And JAMSS can happen for a patient as a follow-up to a dental appointment. It can happen just as a routine experience of something that happened outside the dental office in their life. And it can show up as joint symptoms, muscle symptoms. It can be acute or it can be chronic. So when we think about JAMSS, one of the great things is that we now have a protocol for it. It really is revolutionary in dentistry today, that we actually have an easy to follow, systematic way to not only assess the risk that a patient presents and that a procedure presents for that person developing JAMSS, as well as using that same system to evaluate a patient who's having symptoms, figure out what's going on, and very quickly and effectively treat that patient so that we can have that be a short-term issue and not develop into a more long-term chronic TMD issue for that patient. So when we think about JAMSS, there's a bunch of steps to this I want to talk about, and we're going to divide them up. We're going to start with sort of defining why it's important to your practice. We're going to talk about instituting the protocol and the simple steps that you can do in your office with your team. And we're also going to give you the information you need to do that patient assessment and the patient follow-up, and then to effectively be able to manage risk and treat if a patient shows up in your practice with a post-op issue. So let's move from this video to the rest of the videos as we go through those topics.